Now, the Health Ministry has ordered all central institutions, including AIIMS Nagpur, to install oil and sugar boards, vivid posters spelling out how much of hidden fat and sugar is there in the daily snacks that you enjoy. Yes, we are talking about jalebis, samosas, pakoras and whatnot that you, in fact, took it for granted. Now, cultural staples such as laddu, vada pav and pakoras are all coming under this scrutiny. Meanwhile, it has been also a part of an effort by the government to go ahead and combat obesity. Now, to discuss more about this, we have Dr. Shikha Sharma, founder, One Health and veteran nutritionist, who in fact is joining us. Dr. Shikha Sharma, you know, one of the biggest snacking items that we have in Delhi is, of course, the humble samosa. But now it is being said that the effort is to treat it along junk food, especially with tobacco. Trans fats, what is the trans fat that we are looking at, and why is it important that these boards be put for simple snacks like jalebi or the samosas or the pakoras?
I think this is a wonderful initiative by the Health Ministry, and I'm glad that they are taking this to all the government institutions. In fact, I would say even hospitals where doctors are working, and where I worked as a doctor, most of the cafeterias are only serving samosa and kachori and pakoras with their teas. Now, I can understand that the cafes are managed by people who are not doctors, and therefore they have no idea what they are serving. They are only serving the customer. But it's very imperative that not only should the oil content be listed, sugar content be listed, but the kind of oil used. Because today, a lot of palm oil is coming into our country, which is not going into homes because people don't want to buy that kind of oil, but it's going into restaurants. It's going into such vendors who have no idea. They only look for the cheapest and the most inexpensive oil to cook their stuff. And palm oil causes heart attacks. Palm oil causes cholesterol blockages, and especially because these are very, very deep fried items. So I would say this is imperative, and especially after the pandemic, we have all seen that how many heart attacks incidents have gone up in young people. So this is really imperative for the country, I would say, and a great initiative by the government.
Well, Dr. Shikha Sharma, another concern that is there, more than 44.9 crore Indians are projected to be overweight or obese by 2050. How much is the obesity issue well known within a lot of people in this country? Because it seems that awareness is still limited in only research and in certain elite groups, but the rest of the country seems to be quite blissfully unaware of these.
I agree. I completely agree. In fact, I would go a step further and say that today, now we have to move from information to action and implementation. And as we all know, implementation only happens when there are mandates for every organization and institutions from the government. So the problem of obesity is growing very, very rapidly. And this is not the healthy kind of obesity which we used to see in bodybuilders or in people who are pehlwans. This is unhealthy obesity. This is visceral obesity, which is directly connected to the bad oil, white sugar, too much salt, which is going into our foods. So I would say that if we have to counter obesity, every school, every college, and every government institution should begin by having a health board within their companies or within their institutions, and that health board should under that direction only food should come into the institutions. Like for example, I would say many years back, aerated drinks and junk food was banned outside schools. So the implementation requires some sort of penal action, or at least the capacity of a body to do penal action. Only then it will be implemented, because otherwise we are going down a pathway which can spell disaster for our entire country.
Well, Dr. Shikha Sharma, before I let you go, one final question is this. Now, how do you see the equation of junk food with tobacco? I mean, should that be the thing that, you actually scare the hell out of a lot of people when it comes to certain food? That is the only way to get a response.
Absolutely. I would say absolutely, because tobacco was consumed by a certain segment of people, and the risk was limited. Though tobacco is bad, but it affected a certain kind of people who were taking it knowingly. In case of junk food, pregnant women, children, elderly people, everybody is taking junk food, and it's not even considered as awkward. So what I would say, this is worse than tobacco. I would say, because a lot of people, the exposure is so high, and it is across society. So I think strong action and implementation, most importantly, implementation is required for our country.